Welcome, everyone. I'm happy to host you here today, joined by my colleagues Brittany, Dr. Stuart, and Leslie Martin from Polera to speak about two different things. We want to speak today about the stigma infographic we developed looking at stigma in workplaces and where that is, and then we'll speak to the effects or the newest release we have, our Poll 12, which looks at population level mental health from April 2022, so about a month ago. Without further ado, we'll get started with Heather Stuart. Heather is the Bell Canada Chair in Mental Health Anti-Stigma Research, the first ever in Canada. She's a professor at Public Health Sciences and Department of Psychiatry at Queen's University, my alma mater. Congratulations, great school. She works with a number of organizations. She's a former board member of Mental Health Research Canada. She works on the polling advisory group that we do collecting information about population level mental health. She is the chair of the World Psychiatrics Association Stigma and Mental Health Scientific Section, as well as a member of the Order of Canada and a fellow in the Royal Society of Canada. So congratulations on all that accomplishment, Heather. It's a pleasure to know you. And we'll get started talking about mental health stigma. Brittany, could you get started by pulling up the infographic that we want to speak to a little bit?
Just one moment. There we are. There we go. Sorry about that.
So we put this, actually, you know what, Brittany, why don't you speak to how we put this together?
Sure. So we had a lot of input from Dr. Heather Stuart, which was fantastic, and one of our colleagues, Fatima, and they looking at, so we put my thoughts together. So in collaboration with Canada Life and Workplace Strategies for Mental Health, we did a much larger research project looking at psychological health and safety in Canadian workplaces. And from that study, we were able to pull out questions that were specifically focused on or related to stigma in the workplace. And from these questions, we were able to ascertain which sectors are demonstrating the highest amounts of stigma in the workplaces. So I myself will say these results to me were very surprising. It was a really interesting project, and we were very fortunate to be able to do so and have a big enough sample to do this.
I would say I was also surprised by this. Again, we looked at 32 sectors in our psychological health and safety data set, which was collected in partnership with Canada Life, over 5,500 employed Canadians. We had a number of stigma adjacent questions, and then we correlated those. Dr. Stewart did an analysis, we did our own independent analysis, and these were the results that we came up with in terms of the sectors that were showing the highest employers or employees were reporting the highest levels of stigma or feeling that stigma existed in their workplaces. Dr. Stewart, why is addressing stigma such an important issue?
Well, it has so many ramifications for people who have a mental illness or substance use disorder and their families. It really interferes with their ability to recover. People will avoid going to a health professional because they don't want to be having a diagnosis, because they know all of the stigma that's associated with the diagnosis. So they avoid seeking care, and of course that just deepens any disability that might be associated with their illness. And it costs a lot of money every year for people who have mental illnesses to avoid treatment. So stigma is the number one reason in workplaces, for example, why people won't speak up, and they'll hide the fact that they're ill. And so there's something called presenteeism, where they're at work, but they're not doing their job fully. And so that's costing us about 3% of our GDP, just the fact that people are going to work and they're not being effective in their jobs. So we have to think of ways to reduce stigma, because there's a resource issue, but it's also a very important issue for impacting people who have illness and their family members.
You would know from the work that we're doing in the Health Canada polling that we're doing that we do track a little bit of presenteeism through the question to employed Canadians, how impaired or what percentage of Canadians feel impaired at work as a result of mental health issues. And the number has been, it peaked at around 30%. We're just talking employed Canadians, and is now sort of settled in at a baseline at around 21-22% of Canadians, where if you think of the volume of people who that represents, that's a fifth of the employed workplace is now expressing that they are impaired in some way or in a significant way at work. And then we're talking that translates to 3% of GDP, I believe is what you just said a moment ago.
Up to 5 sometimes, 3 to 5 is the estimate, yeah.
I mean, when you think about the billions of dollars that's actually costing the Canadian economy, if we could reduce the amount of people who are afraid to talk about mental health in a significant way, then that would have a significant impact. That's an incredible statistic.
It's not only talking about it though, employers have to know how to manage it when somebody comes forward. So, you know, people who talk about it could actually be setting themselves up to be stigmatized and to be discriminated against in the workplace, passed over for promotions, isolated from coworkers. I've heard horrible examples of, you know, people being mobbed by their coworkers, people being fired outright, which is actually against the law. So, you know, the employers need some support and some help to figure out what should they do when somebody comes forward with a mental health issue. How do they create a stigma-free zone? How do they make sure their employees have the appropriate accommodations that they need to be able to do their job to the fullest? People who are in supervisory roles aren't there because of their people skills necessarily. Usually they rise up because of their technical skills. And so we need to make sure that employers and supervisors have programs and interventions available to help them build that skill set that they need.
Yeah, and just to build on a few things you said here, first off, in terms of the people skills versus the technical skills, that's one of the areas we're currently studying, as you know, looking at some of the data in terms of emotional intelligence and how that correlates by sector to understand a little bit more about what makes effective leaders. The other thing that, of course, went into our stigma analysis you touched on was we do ask questions. If I were to talk about a mental health issue with my boss, would it impair my ability to, you know, be promoted, move up the ranks? And this is a significant issue where we saw in a lot of these sectors where we listed them, we saw this as a significant factor as part of that analysis we did. Now, I'm curious a little bit about mental health stigma and what's different about workplace mental health stigma versus the stigma we might see in an everyday life. Do you have any thoughts on that?
Yeah, I have a colleague here at Queen's that did a very detailed study about that. And the stereotypes in workplaces are different than the stereotypes of the general public. So the general public might think people are lazy or whatever, but in a workplace, there's considerable concern for whether a person can interact appropriately with clients, with other people around them, whether stress of a workplace will trigger an emotional or mental health issue, and really, you know, just not knowing how to deal with a coworker who's been away, they're coming back. How do we, you know, ease them back into the workforce and make the accommodations that they need, and make sure that people don't feel that they're getting, you know, charity from the employer. That's a big issue in workplaces. They're doing less work, or they're having more flexible hours, and it's seen as a charity case. So the stereotypes are different. But I think the behaviors ultimately are the same. They're discriminatory, and it could be like not being promoted for a job, you know, a job position, not being hired. But at the root of it, it's discrimination that happens because of these stereotypes.
And I just want to pause here for a second to tell the people who are watching us, there will be an opportunity to ask questions to either myself, Brittany, Leslie, or most likely to Dr. Stuart at the end of this first part of this session. So if you do have questions, please prepare them and get them ready, and we'll be happy to discuss them in about 10 minutes. So again, something that is off book from the questions I committed to asking you here, you brought it up yourself, where you asked, you said that there are a need to create stigma safe zones, I believe is how you indicated, or the opportunity to talk about it. You know, you and I both work with a number of the organizations that provide resources that actually are helpful for that. I'm thinking specifically, there are great resources from Bell. There are great resources from Workplace Strategies for Mental Health. Mood Disorders has the Elephant in the Room campaign. And of course, the Mental Health Commission of Canada has the Working Mind, which covers this a little bit. as well as Not Myself Today, which is part of the Canadian Mental Health Association's portfolio of workplace mental health. And anything you would speak to as being really important for opening up that dialogue between leader and people leader and employee as it pertains to having that conversation? Like how would you suggest leaders introduce that to their workplace, or how would you suggest it gets raised or pushed forward by people leaders?
One of the things, there are courses and interventions out there, as you pointed out, so there needs to be some political will inside of organizations to make those available. But at the basis of it, a supervisor is going to notice a loss of productivity in an employee. Or say in my work as a student, I will notice the student is missing class or their marks are declining. And so that is the time when you want to call them in and say, look, I've noticed that you're missing deadlines, your work is suffering and it's not like you. And I want to know, is everything okay with you? Is there anything that you need me to do to help you? And sometimes you'll find that people will say no because they don't want to talk to their supervisor about their mental health issues. But if the thing persists, you can go at it again and again and again and tell people, look, I'm here to listen to you. I'm here to help you. What can we do to make sure that your productivity is not suffering? So you make it into a productivity issue. There's all kinds of stuff online that you can get. Australia has a lot of really good examples of role plays that they do. Eventually, people will talk. And, you can say, is there anybody you need me to reach out to? Do you want me to get one of the human resources people to talk to you? Do you want somebody outside of the office to talk to? And I think if you can open that kind of a dialogue with your employee, and if you've been a good supervisor, somebody that is trusted, not somebody who's likely to lash out once they find out, I think you'll find that employees will open up and they'll be quite relieved that they have somebody there to help them.
That's fascinating. I was curious in terms of the specific stigma brief that we prepared that you did an analysis on as well too. Brittany, if you could pull that back up, thank you. I'm curious, what surprised you about this?
I'm sorry to say that nothing surprised me about this. I was quite expecting it. I guess if I could say one thing though, I would have thought accommodations, I thought it's 38% feel that they're not supported. I would have thought that might have been a bit higher. So it's high, but I was expecting it to be around the range of some of the other items like 58, 59, 60%. But I wasn't really surprised to see these kinds of numbers because we know that this is a problem. And it's particularly problematic in agencies that are sort of building a culture of machismo, like police, military type agencies, police, paramedics. They have a lot of difficulty because, especially with police, if their supervisors in many cases find out that they're having mental health issues, they will be put to a desk and their weapons will be taken away from them. And that's a huge, shameful experience that they will go through. Paramedics are the same. I mean, they have to respond well under stress. And if their employers find out that they're having a mental health issue, which they could because they accumulate traumas in their day-to-day work. The good news, though, is that the Mental Health Commission of Canada's program that you mentioned, the Working Mind, has been really embraced by police and paramedics. And they've trained now maybe 20 or 30,000 people across Canada. So, and they've evaluated the programs. They seem to work, but they're not getting out widely enough. So it requires the employers to pick up on it. So no, I'm sorry, I'm not too surprised by any of this.
And Brittany, could you scroll down to the bottom?
Yeah, sure.
In terms of the ones that had the least amount of stigma, I mean, I was surprised. I thought construction might be another one that might have higher one, but then I don't know. I didn't quite know what to make of this. I don't mean in any disrespect to that profession, but it was interesting that one came up as very low. I don't know what to make of that.
Do you remember what the percentage was, anybody? what it was for that one, or can you
We have
call
to
it
pull
up?
up the analysis.
Yeah.
No, I don't remember. And
I
then
can work on finding it, and I'll pull it up if I manage to dig it out
Okay.
before this segment's over.
great. And then Leslie, you looked at some of this as well too. Any thoughts on this issue?
I think I felt a lot like Dr. Stewart with the ones that were having issues. I'm not surprised about construction. Actually, Michael, it did surprise me as well, because I know with some other work that we've done that industry can have a lot of issues. People, the stigmatisms are high in that industry for sure. So that one did surprise me.
And just closing off here, Dr. Stewart, while Brittany can try and find that number, what's the number one thing that individuals or employers can do to challenge mental health stigma? And I'm going to break this a two-part question: individuals in their personal life and employers for professional life.
Well, I think the first thing that everybody should know is that they can all make a small difference. So, understanding that you are part of the problem or you're part of the solution. And if you become part of the solution, then you can find all kinds of different ways to make a difference. It might be, as I mentioned, asking somebody, you don't seem like yourself today, how are things going? Or somebody returning to work after a disability absence. Hi, nice to see you. Let's go for coffee and catch up. Simple little acts of kindness like that can make a huge difference. I should also mention that the Bell Let's Talk website has 5 simple things that people can do. One of them is changing their language, making sure that you don't trivialize mental illnesses or use derogatory terms, because you never know who's listening to you. They might have a family member, they might themselves have an illness. And so just, watching your language, making sure that you're kind and supportive, those are big things that can be done, and they make a big difference to people. So everyone should do something and learn more about how they can do things, and just be very helpful and empathetic towards people who may be having an experience of an illness.
I'm just circling back to your question about the score for construction. It was 6.8, which was followed only slightly by management of companies and enterprises at 5.4.
And some of the times it's the type of people who choose to answer the survey that makes a difference, right? So we never know when we get these numbers, is this a true representation of what's happening in the construction industry, or is it more an example of who's in the construction industry is willing to respond to surveys? And so, we never know, but it is a low number, that the one that you've just given us.
Well, and again, we had a massive sample on this and a pretty good size construction response. So I'm less skeptical of the number itself. Looking at the underlying data, I'm thinking perhaps it has something to do with the nature of the culture that has been developed there, that perhaps I'm misunderstanding the culture more than anything. The best thing about doing data analysis is being surprised, because what it basically means is you come in with a preconception as to what's going on, and you get challenged all the time. And that happens to me. We publish so much work. There's always something that you're wrong on. And, I think the most important to do is to approach it with an open mind, to say, like, maybe I had a preconception that's going on and it's not reflected in what the data is saying. So I don't always go first to, is the data wrong? It's always valid to ask that question, but I always ask myself, am I wrong first?
I always go for the data first. I'm an epidemiologist. That's how we're taught to think. But the thing about construction, it makes me think of some early studies that were done looking at how people with schizophrenia fared in low-income countries versus high-income countries. And they actually did a lot better in the low-income countries, even though there were fewer services and treatments available. And that's because the nature of the work that they were doing, which was largely agrarian, farming, the mental illnesses didn't disable them to the same extent as if they were in, another type of industry, one that put a lot of cognitive load on them. So maybe something like that is going on in construction. People are outside, they're working, working physically, and the mental illness is not necessarily getting in the way as much for them.
Certainly, yeah. And again, these are always challenges you come up with when you have these answers, it always leads to more questions as to the why and how these things get there. It's something I don't know we'll be able to answer today, but that's as good of a theory as any other that I've
Yeah, but you know, qualitative work that you're going to be doing shortly, I hope,
yes,
could get at some of these answers. You could be interviewing people from these different industries to find out. The fact that it varies across industries doesn't surprise me at all. It's not a universal, we know that. I mean, it's quite pervasive, but it's not a universal. We've seen that across the world, and not every culture has a stigma culture to it. Some more than others. So yeah, but I don't really know how you would figure this out unless you did some qualitative work.
Agreed. Before I open it up to Q&A, I see one question. Perhaps Leslie can speak to the question around the methodology and how it was collected. But Dr. Stuart, did you have anything you wanted to add before we close off this section?
No, I'm just looking at a thing in the chat, which is a very good thought, that physical labor lowers instances of mental ill health, physical exercise. So it could be that the physical health of the construction workers is much better. That wouldn't necessarily explain what's going on in finance and legal and insurance and those other sectors. But right. That's a really good thought from Caitlin about what might be going on in the construction industry.
Yeah, and it's also possible that they may have two sectors that are both having different reasons that their stigma has been reduced. That doesn't necessarily mean that, yeah, it might fit for construction, but it wouldn't fit for some of the, sort of administrative roles that are indoors. Mm-hmm. But those could possibly, and we've seen this in a lot of, when we looked at some of the legal profession and a lot of the indoor ones, that they were doing better, but that's simply because a lot of those organizations had spent more time working on those issues. But that doesn't mean that those who don't have inherent positive things happening that are driving that too. So, well, thank you, Dr. Stuart. Is there any other questions before? And Dr. Stuart, you're welcome to stay for the second half where we talk about our poll 12 results. I know you've seen them.
I know, but I'm late to stay.
Great, you're welcome to. You're also welcome if you need to go at any time. We're just glad to have you. Any other questions? Methodology. Did we answer that question about methodology? So, Kayla and I can answer this. This was part of a massive data set we collected called the Psychological Health and Safety in Canadian Workplaces Study, which was 5,500 responses. It was collected online. I believe Leslie was using the Leger backend system. And again, it was just employed Canadians using a large, I don't know if you're familiar with that system, but there are 500,000 Canadians at any given time who are signed up to that system and are incentivized to respond to surveys or polls. They might get some sort of a point, or Tim Horton points, or whatever sort of point system there is. And then they're not aware what they're going to get. And then they're told they can get points for this sort of a system. Leslie, I don't know if you want to speak to the methodology more than that.
That about covers it. We do, the panel is recruited in a number of different ways. So we make sure we don't get everyone from one methodology. We do phone recruiting, we do points recruiting, we do a number of different recruiting so we get a wide variety of people. They do a lot of tests on their panel to make sure they're representative. The data is also weighted to make sure it's representative based on the latest census data.
Yeah, although I don't think we had to add a lot of weight to our data.
No, and we make sure we don't, but we always have that there, but we make sure that our sampling is also representative.
Great. All right, well, talk was different from that. Are the ways you can create safer spaces? How can employees create safer spaces?
Oh, we're going back to stigma. Okay, they can recognize, first of all, that they need to create safer spaces. So the first part is like understanding the issue. And then there, as I mentioned earlier, there are a number of programs that are available. The Mental Health Commission's program is a particularly good one because it's been evaluated and it's been found to be effective and it's free. And so that's some programs aren't so free. Most of them have not been evaluated, so we don't know, how effective they are. But certainly recognizing that there's an issue and then recognizing that there are potential solutions are important things to do.
Fantastic. Any other questions? All right, well, without further ado, we'll move on to the second half of our agenda, which is the poll 12 results. I'll just preface that, and then I'm going to hand it over to Brittany to take us through a little bit, if that's okay, Brittany?
Fantastic, yeah.
Great. So I'm not sure who's joined us in the past. We have been collecting mental health population level data since April 2020. This is our 12th collection, which is quite substantive. We did 3,000 Canadians coast to coast, April 13th to the 25th, with, yes, again, a sample of 3,000 Canadians representative. And as Leslie mentions, it's recruited through a number of methodologies, but it's an online collected data point. We are advised by an internal advisory group, which includes Dr. Stuart, who's joining us here today, as well as a number of other experts. And I'm happy to report, I don't know if anyone caught this, but we have been funded by Health Canada, our partner on this, to do this work for a further 3 years. So we will be collecting and tracking our sample for an additional until 2025, which is great work, great news. It means we're going to be busy. And I'm super appreciative of Brittany, who is now spearheading and managing the bulk of this portfolio right now, and Leslie, who's done a great job in terms of collecting and putting the basics and the structure of this report together for us. If you have any questions, if you could hold them to the end, we're more than happy to take them. We'll try and leave 5-10 minutes at the end at least to cover this off, probably more. But without further ado, Brittany, do you want to take us away?
Absolutely. I do want to start by saying that for those of you who aren't familiar with our pooling, what's in our reports isn't the entirety of what we collect. So we have, as Michael mentioned, 3,000 participants and a host of different demographic factors. And we have that all housed in our systems. And if anybody has the capacity to do their own analysis and would like to do so, I'm going to put my email into the comments at the end, and feel free to reach out to me. And as part of our own mandate, all of our research is freely available to those who would like to use it for their own purposes. So, on to our major findings. So the major finding for this poll was that positive indicators of mental health are positively trending. So what that means is that although we haven't seen a great increase or decrease in those who are experiencing high anxiety, we are noticing from poll to poll that it is improving, which is a good sign. So high levels of self-rated anxiety, so those who are saying that their levels of anxiety are between an 8 and a 10, have decreased from 24% in December to 21% this poll. Also, our clinical screeners, the Kessler-10, the GAD-7, and the PHQ-9, which look at severity of mental health symptoms, severity of symptoms of anxiety disorders and of depression. They are also demonstrating marginal improvement when looked at from a long-term, I suppose, over the last couple of months. That being said, we are still quite a ways away from where we were prior to the pandemic, so we do still have a lot of work to do, so it's important to keep that in mind. Another interesting finding based on the fact that indicators are trending positively is that concern around COVID-19 has, rather than dropping as we expected, increased marginally from 59% to 61%. So this includes concern over the lasting impact of COVID-19 overall, as well as fear around yourself or a family member actually contracting the illness. Any comments on those first 2 points? They kind of go hand in hand, so just want to take a quick break before we move on.
No, I'm going to address the questions in the Q&A as fast as I can.
Okay, fantastic. So one question that we added this poll that we found really interesting, and we are still continuing to refine a little bit. We wanted to learn about mental health literacy in Canada. So we use the metrics. How often do you think about your own mental health, the mental health of others? How often do you consume knowledge about mental health? So how often are you reading about it, listening about it, watching about it, and how often are you speaking to a mental health professional about mental health? So what we found from this question is that Mental health isn't a topic that's frequently discussed in Canada. This is something that certainly has a lot of room for improvement. 1/5 of respondents report that they never think of their own mental health, and we have found that those aged 55 and over are the least likely to do so, with only 4% reporting thinking about their own mental health on a daily basis. And based on these same metrics, we're showing that students, which is unsurprising to me, particularly, are demonstrating the highest levels of mental health literacy. So we do have some more details on that further along in the presentation. Another major finding, which we reported on before and hasn't changed, is that more than 1 in 10 Canadians have thought about suicide in the past year, and 3% have reported planning an attempt. So the reason that we put this back into our major finding is that the Mental Health Commission of Canada, in collaboration with the Canadian Centre for Substance Use and Addiction, have recently released a report that found that suicide ideation was higher among Black Canadians, and our findings did show the same. Our findings found that specifically Black Canadians with primarily African ancestry are experiencing high levels of suicide ideation rather than those with Caribbean ancestry, which we found really interesting and certainly something to keep an eye on. So we did find that Black Canadians with primarily African ancestry, over 5% report having planned a suicide attempt in the last 3 months, which is pretty staggering. And another factor we wanted to look at this poll that was interesting is we wanted to look at new mothers and see how they're faring throughout the pandemic. So particularly mothers with children between 0 and 1 year olds. We're looking at perinatal data. And what we did find was really interesting, and that 3 in 10 mothers of children of this age are experiencing high levels of anxiety. And this is higher than the national average, where we found that 21% of the national average is experiencing high levels of anxiety. But that being said, new mothers are also reporting feeling very hopeful for the future, and also reporting having great relationships with family and friends. And that is the end of our major findings. I'm going to pause, so if anybody has any questions, you can have a chance before I go into the deeper data.
And while they're posting questions, Leslie, is there anything you wanted to add?
Yeah, I just want to say both of these points from this slide I found very interesting and concerning, of course. Like when you're looking at the anxiety of new mothers, this is a crazy time for a new mother, and they have so much responsibility on them, like to have to deal with mental health and the anxiety on top of that. I think that's something that we really should keep watching and consider, because that can have some very serious ramifications.
And I will add on top of this, especially around the perinatal mental health. This is an issue that we've been hearing a lot about, had a lot of questions about over the last 2 years, and we're excited that we're able now to start collecting this data. But our intention is to collect it over several different data collections, so that we can also slice this up in a more interesting way, where we can look at visible minority status and perinatal mental health. We could look at age of mothers and perinatal mental health. We could look at diagnosis of mothers previously to COVID, and a whole bunch of other crosstabs we could add on top of this to try and really break out the specifics in terms of understanding who in that group is the most at risk of having some sort of a mental health challenge, which I think is something that from a data perspective, I'm excited to really be able to tell a story and a narrative around that.
Absolutely. And just to elaborate on that, for those who aren't engulfed in data every day, we've just started reporting or collecting data on mothers with children between these ages. Prior to this, we had between the ages of 0 and 2. So while we did have a big enough sample to report on what we have reported on, it'll take a much larger sample over the collection of a few more polls to slice and dice a little bit more.
Great. Let's move on.
So these are our key findings, which I will be touching on. I know we don't have a ton of time, so I'll be touching on these as we go through the report rather than sitting on them at the moment. So here we're seeing, since the onset of COVID-19, anxiety and depression diagnoses have increased in Canada, with an additional 6% of respondents reporting an anxiety disorder diagnosis and 7% reporting a diagnosis of depression. Younger Canadians and healthcare workers, we've seen throughout our polling series, are more likely to receive an anxiety diagnosis. And we've seen the same in self-reported high levels of anxiety. We are seeing the same vulnerable groups reporting high levels of anxiety, depression, and diagnosis.
This has been extremely consistent.
So here's what we discussed before. While this is a very small decrease in individuals reporting high levels of anxiety, if we look back, there we go. So if we look back over the last couple of polls, we can see that it is going down from poll 10, and poll 10 was collected in December. Michael, is that right?
December, yeah.
December, yes.
Right before.
So
yeah.
Yes. So we can see that high levels of anxiety did peak during poll 6. And we can also see that levels of high anxiety prior to COVID were much lower at 5%. So the hope is to eventually.
Just poll 6 was in April last year. Just to put that in there, poll 6 was April. So that's when we saw of 2021. That's when we saw the peak.
April 2021 looks like the peak of the mental health challenges of Canadians.
Yes.
Put that very simply.
So we certainly can't necessarily say that we are for sure on the road to recovery, but we are seeing some positive signs in terms of mental health recovery. So this is something that we collect. We collect regional data every time. It's really hasn't changed much. What we find, one thing we find interesting is that Quebec is consistently showing the lowest levels of anxiety and depression, as well as the lowest levels of fear of COVID and a couple other factors. We can't necessarily speak to why. It's just for us a point of interest. And these are the clinical screeners that we discussed earlier, that they are showing marginal levels of improvement. So the Kessler 10 shows level of severity. One thing that is important to point out is that these are clinical screeners. They're not diagnostic tools. So our respondents are reporting their symptoms. And then from these screeners, we're able to tell the severity of the symptoms that people are reporting. So we have these 3 tests. We implemented these tests, I believe, in poll 4. This is one that we've had going for a while, just looking at Canadians' ability to cope with mental health challenges caused by COVID-19. So again, we are seeing a little bit of improvement here, from 21% saying they're not able to deal with these challenges to 19%. It has been staggering a little bit over the past couple of polls, so it'll be interesting to see how that looks in our next collection, which will be, by the way, in July of this year. Michael mentioned this while Dr. Stuart was talking about stigma earlier. It is the Sheehan scale of disability, which demonstrates the impact of mental health symptoms on people's day-to-day life. So we are seeing that 24% of respondents are experiencing impacts on their day-to-day life caused specifically by their mental health challenges. And as we dive into this a little bit further, we can see that folks are saying that their social life and leisure activities are the primary thing being hit, followed by home and life responsibilities, and school and work are tied. And then we can also see how much time people are losing due to these mental health challenges. This really hasn't changed at all over the past couple polls, but we are seeing certain Canadians are more likely to lose time, particularly frontline healthcare workers, which is unsurprising due to the very high, I imagine, levels of burnout that have been experienced over the last couple of years.
The one thing I wanted to point out here is that this analysis on this slide is just employed Canadians and students, while the other slides are for all Canadians. So there's sometimes a slight change in numbers with a similar question, depending on whether we're asking employed Canadians or all Canadians, or so small differences.
And this is just diving in a little bit deeper. One thing that we were looking at very closely for a while was vaccine status and the impact that it was having on mental health of Canadians. We are finding that that gap is shrinking to pretty insignificant levels at this point between vaccinated and unvaccinated Canadians. This one really hasn't changed over the past couple of polls. We have been asking people how they're feeling anger-wise. Are you angry with yourself? Are you feeling angry with others? Again, we are seeing that particular groups in Canada are feeling angrier at themselves and others, particularly young Canadians, those who are unemployed, members of the LGBTQ2S+ community. And these are groups, as I mentioned, that we are seeing from poll to poll that are seeming to be particularly vulnerable mental health-wise.
Something I just caught here, younger Canadians, 15%, is that 16 to 17-year-olds?
Younger Canadians.
Versus
Yes.
18 to 34. So that's got to be 16 to 17-year-olds. Sorry, that typo on the last bullet there. Those are 16 to 17-year-olds, I think, compared to 18 to 34, 35 to 40. So it's just missing a small thing there. Yeah, sorry.
These run-throughs are great, actually. Normally we are able to find all the errors before, but going through slide by slide with you all actually helps us find some of them. So this one I mentioned in our major findings. This is our suicide ideation data. So from here, we're seeing that 12% of Canadians report having thought about suicide in the past year, and 3% of Canadians having planned a suicide attempt in the past year. As mentioned previously, there are groups that are more vulnerable, particularly frontline healthcare workers.
It should be worth noting that there's a Venn circles happening here where you might have thought about suicide in the last 3 months, and that would also, you theoretically should include people in the last year, but some people answer this question to say that I thought about it in the last 3 months, but not in the last year, so they exclude that. So when there's a reason 12% is not 7% and 8% adding up together, that would just be the individuals that have answered one of those two or both would be 12%. So just a bit of clarity in terms of the way we've decided to speak to this question, which is 12% have thought about it in the last year, which would include 8% who said they thought about it in the last year, plus people who said they thought about it in the last 3 months, but somehow didn't think that counted in the last year.
So yes, we do have to be careful of our reporting because we certainly aren't saying that 15% of Canadians have thought about it in the past year. So yes, that is an important distinction. And Michael, just to clarify, are we wrapping up at 2:30? Just want to make sure we have enough time for questions at the end.
What you mean? I think you mean 11:30.
Or so sorry, East Coast time.
East Coast time. Sorry, yeah, we're wrapping up in 14 minutes, so we can finish this off in.
Okay, fantastic. We are consistent.
Wherever you are, it's not 2:30 though.
Yeah, it's not East Coast time. It's 12:30 here. It's also lunchtime, so my brain's just
somewhere in the middle of the Atlantic Ocean. It's 2:30. Yeah. Okay. Sorry.
So we are consistently finding that social isolation is having a negative effect on mental health of Canadians. That hasn't changed at all throughout our reporting. We don't expect it to. And another thing that is staying consistent is that going outside is having a positive effect. So this varies a little bit from poll to poll, largely, I imagine, depending on the weather. One thing that we did add this poll that's interesting is we wanted to know if the challenges of your current job that aren't related to COVID-19 are having a negative effect on your mental health or a positive effect. So we did find that 29% of Canadians are saying that workplace challenges not related to COVID are having a negative effect on their mental health. So we will continue to follow this incoming polls. This has remained the same, 65%, which is pretty positive. 65% of Canadians are saying that they're confident in their ability to recover from mental health challenges. This has remained fairly consistent throughout our entire polling process. It's a good sign.
I really love that one, the fact that most Canadians remain resilient.
Yeah, me too. And also, our question about hopefulness is very positive as well. 66% of Canadians are feeling hopeful about their future. Let's here for a second. Another question that we added last poll was concerning burnout, which showed some interesting findings. So 24% of Canadians are experiencing burnout, but this number is a little bit higher, obviously, among employed Canadians, because this percentage gets much lower for Canadians of retirement age.
It is improving
This is
though. The burnout numbers are improving.
Yeah, true. This is our mental health literacy question. I said we would go into a little bit more detail when we got to here. So 2/5 of Canadians think about their own mental health at least a few times a week. This we have already discussed, and the next page is kind of when we get into the details of it. So this, we are looking at comparisons between different demographic factors, those living in urban centers versus rural areas. We look at age, we look at household composition, students, unemployed. And as I mentioned, students are demonstrating to be the most mental health literate based on the metrics that we've put in place for this question.
Interesting question from Caitlin here about introvert versus extrovert status. And I don't know how to answer that question. We don't study introvert because I don't know how to collect information to define. You could ask someone if they're an introvert or extrovert, but whether or not we can validate that, that's a tricky one. It's an interesting question though. I will put some thought into it.
Yeah, that is a really interesting one. This one we mentioned before, concern has gone up over the threat of COVID-19 this poll. One question that we are considering asking in our next poll, we're just trying to figure out how to ask it specifically, is finding out, because we did ask this earlier in the pandemic, whether or not you've had COVID before, and our numbers were fairly low. At this point, I imagine the numbers will be quite high, but it would be interesting to see the correlation between those who have recently had COVID and their concern over its lasting impact, and those who have maybe had it 3 months ago, because the information that we've been given is that your immunity starts to wane around 3 months from what we understand. So that's gonna be an interesting one to find out our next poll, so stay tuned for that. This is another interesting one that goes hand in hand, we think, with the concern over the lasting impact of COVID-19, is that support for public health measures has actually increased since our last poll. So,
I don't understand that either.
No, so 60, or make sure my math's right, 65% of Canadians are indicating, no, that's not right.
75%.
Thank you. Lunchtime, are indicating that they do want some public health measures to stay in place. What was interesting to me was that those who initially said that all public health measures should go has decreased this poll.
Just for clarity as well, we look at public health measure support, similar to why we collect some other information, is to understand if there's any correlations between public health measures, support for public health measures, and mental health status, to understand if people with diagnosis or who are struggling with their mental health are how they are specifically feeling about public health measures and what impact the removal of said measures or the lack of removal of said measures would actually impact their mental health. And it's just fascinating data.
Mm-hmm. Yeah, absolutely. And then this one hasn't changed. The primary reason for wanting to keep all public health measures is that people are still catching the virus. And the primary reason for wanting to remove them is that the virus will be around, so we should live with it. So it's just, this one isn't necessarily mental health related until we start to break down the kind of demographics and self-reported mental health of respondents, but it is an interesting point. And then finally, we look at mental health supports in Canada. So specifically, we're seeing that 22% of Canadians have accessed mental health support since COVID-19. One point that we really look at each poll is this percentage down here, this 11%. So this is Canadians who are saying that they didn't access mental health supports, but feel that they need them. So this is something that we do track closely. And we also look to find out the reasons for not accessing mental health support. So this is prior to COVID, with the primary reason being that they preferred to manage themselves. That hasn't changed, but it is something we looked into. We are doing a bit more detailed analyses on those who say that they haven't accessed but should. So we are trying to figure out more details on who these people are and their reasons for not accessing.
Thank you, Brittany. We'll open it up for the last 6 or 7 minutes for questions. I appreciate any questions anyone has, and really just fantastic job, Brittany, going through this. There's certain things in this that have not changed since the start of we started collecting, but it's the small nuances that change over time, like the improvements in the mental health indicators coming from April 2021, as well as the fact that resiliency has not really gotten any better or worse. Those are great indicators to track. And again, I think the part that surprised me the most was the support for public health measures. And we have seen that there, Leslie, you can correct me if I'm wrong, but my recollection in just reading that was that there was greater support for public health measures among individuals or there was higher anxiety and depression among individuals who were supportive of public health measures. So there is some correlations there, although we have not seen any correlations significantly on the vaccine status, where we used to see some correlations with depression, which was interesting. There's some interesting data and how it's changed over time, I think is interesting. And I think from our perspective, we're starting to evolve the project, because it's not going to be about tracking COVID, necessarily in COVID recovery alone. 2 years from now, we have a whole new set of stressors that are moving in with the potential recession, high inflation, and all that causes as well, Russia, Ukraine. And so we're really interested to see how this evolves over time, and those questions stop being really just COVID related, but also start being about the other stressors that we're concerned about and how that impacts. So just a few thoughts going forward while we're waiting for questions. We have one question, but before we get to that, Brittany, anything you wanted to say overall before I move on to questions?
No, I think my opinions were kind of scattered throughout. I also was surprised about the public health measures question. And Caitlin, I see your comment. Thank you for that. The amount of questions that we include on these surveys is one of the details that we spend a lot of time on before submitting them, just to make sure that somebody doesn't get 3/4 of the way through and just say, you know what, forget this. This is too long. So yeah, that was a good question.
And just Brittany, just to kind of make a comment on that, we do a lot of analysis before the analysis gets to you to make sure that these questions are valid. We do speed tests. We do, if someone's sort of straight lining it, we call it, because if they're sort of answering the same thing, or they answer it too quickly, they pulled out of the data. So I want to reassure that we make sure we have a lot of different measures to make sure that this is valid data. It's not just people going, I'm just going to answer the question as quickly as I can so I can get my points. We make sure that doesn't happen.
And I think I would only answer that to say that we have people very smart who work on this. Who make sure that we ask the questions in a way that encourages people to continue moving on. It's not just about the incentives, it's also about trying to make the questions accessible, language accessible. We do a lot of work, a lot of testing to make sure that the questions are simple enough that people can understand. It's a group effort. Certainly I'm very proud of the work that everyone does on this. Any other questions?
I'm going to add my email here at the bottom. If anybody has any questions after the fact or would like to contact me about accessing our data, please feel free.
Well, then I will close off with a few remaining comments. Our next collection will be in July. We'll report on that in probably the second week of August. I'm on vacation a few of those weeks, so I'm trying to do it before I go to Europe for a little bit, but well-earned vacation. The second thing I wanted to add is that the data is actually freely available to any institutions or organizations that are interested in mental health data. We're proud that we have now 31 data partnerships where we turn the data over to governments, nonprofits, and a number of other institutions, research institutions, to actually study and deep dive. We're over 40,000 data points now, I believe, which is an incredible amount of data with the scope of demographic data we have, lots of which we don't even put in these reports because it's just too much. So I'm really proud of all those data partners and the reports they're publishing with this work. But if anyone here is from an institution and wants to deep dive into it, please reach out to Brittany, and we're happy to address that. I don't see any additional questions, so I will close this off. And thanks everyone for your time, and we hope to speak to you again in August.